Hi, everyone. I'm the director for our New Zealand registered not-for-profit charitable trust called Common Knowledge. Now, our mission statement as a not-for-profit is to just support a viewpoint that any and all healthcare that you use as a family or an individual or society is up to you. So our trust is not pro medical or anti medical or pro traditional healthcare or anti traditional healthcare or pro natural health or anti natural health. This is your life as it is my life, and our trust represents a voice that says use everything and anything that helps you feel better. So that's what I'm talking as the director for the trust. I'm also a naturopath, and I've been one for 50 years. So I intentionally chose in the early 1970s not to get confused with people who are licensed to prescribe, diagnose, and treat. So I chose to be a naturopath. I chose to work in natural health because that was my choice. And I chose to be an educator rather than a practitioner. And today I want to talk to you about modern healthcare, traditional healthcare, and natural healthcare as it applies to COVID. Now, you see on the screen two pieces of paper. Our trust put this out in early of May 2020. I was just recovering from COVID. I live in New Zealand, and I was doing a lot of research at that time, January, February, March. And what I was discovering was that no government around the world, no health system around the world had any suggestions of what you do if you felt you had started to get sick with COVID. There were what we know now as the ways to try to prevent it. Wear a mask, but in New Zealand they didn't have any masks, so you couldn't wear a mask. Social distance, cover your cough or sneeze, things like that. Don't go into crowded places. Keep moving, isolate. We shut things down to try to stop the spread of this virus. But if you got it, the advice around the world in every country was the same thing. Go home, socially isolate, don't overwhelm the health system, but go to the health system if you have trouble breathing, which left a gap, massive gap. It's not the fault of the medical profession. It's not the fault of governments. This is new and it is global. So we put out the self-help guide. This is a natural self-help guide for you to use as soon as you feel you're unwell. And you can download it and pass it on to people. We chose the things in the self-help guide because they were common knowledge. Our trust is called common knowledge. People around the world in all cultures will do these things for different reasons. And the purpose of doing them, we're not going to eliminate or cure ourselves from getting COVID, is we are helping our body deal with this new virus that has come inside us by cleaning out the wound, the back of the nose and the throat, by hydrating very specifically to help our body flush the metabolic waste products out of our body through our kidney and our liver, to shower, to wash off the metabolic waste products, to drink warming foods so that our body doesn't have to warm up nutrients before it gets used. Common sense, common knowledge skills. The lung exercises, one I picked Western through nurses or pulmonary respiratory therapists, and the other was traditional, Shaolin. That's traditional. So I want to talk to you a little bit about modern medicine, traditional medicine, and natural medicine as it relates to COVID long haul. Here's a simple bottom line. No one knows. That's it. But the conversation can't stop there, right? Because if we don't know something, that's okay. But we find out more about it over time. A lot of people in the long haul COVID groups have multiple symptoms. I made a list of the symptoms. There are about 20 of them. Some of them are within the cardio system, skipping of heart rate, things like that. The missing the beat. Some are respiratory, feeling oppressed in the chest, feeling breathless. Some are circulatory, red hands, what look like hives, right? Everything, brain fog, that's pretty much every system. And so when we look about that extreme fatigue, we look at all those stuff. And when people have multiple symptoms and they're not feeling well, they want to get fixed. That's a normal thing. What I've been trying to explain to people is that this virus is new. It's not any different than any other trauma that comes into your life. And some of you have already experienced that. And you know how disorienting it is when you're traumatized. The trauma doesn't necessarily mean a bad thing. I mean, there are women who give birth, loved that they had a baby, but their birth was traumatic, right? Where they didn't feel they recovered from it. But let's just take really traumatic things. Tornado wipes out your house, a flood wipes out your house. Somebody drops a bomb on your village, right? Or one of your children die. These are traumatic things. And this virus is right up there with being traumatic things. We don't expect people to recover from trauma right away, but we have an expectation from what I read on these long-haul Facebook groups is I should be better right away. I got over the acute phase. It's still 3 months later, 6 months later. Imagine if one of your children or your partner died. Would 3 months be long enough for you to grieve that loss? Probably not. So people with long-haul COVID, first of all, they're being unrealistic. We don't know anything about this virus. Nobody does. None of the men and women in the medical profession know about it. They're getting to know about it. They're learning more. So what have they learned? Well, when I started to do the research in January, February 2020, it was a respiratory virus. Then it became clear that it was something other than just a respiratory virus. And so it's become a cardiovascular issue, but it's something more than that as well. It's become an autonomic nervous system issue. And so when people say on the Facebook pages, I'm sick of people telling me it's all in your head, my head. It is all in your head, and it's all in your body, and it's all in your emotions, because all of those things are you. So when you're feeling poorly in any of those three places, the other two places feel poorly as well, because it's you. And so when you go to the medical profession, expect them to know, you're being unrealistic with them. And when you feel disappointed by them, you're being unrealistic about what modern healthcare can do. They can diagnose, they can say you're short of breath, and they can then say, well, we'll give you a ventilator, right? Or we'll do more tests. Or this is sort of a symptom in this sort of class of disorders. They can do that. And then the question is what? Should you follow their advice? That's up to you. That's what our trust says. Do whatever you want. However, from our viewpoint, it's a good idea to begin to do things for yourself because you ultimately have to do things. If a tornado hit your house, yes, you would get people to clean up the mess, but you would help them and you would clean up the mess. You would get people to redesign your house. Maybe you can't do that. But you would help with the building or the painting or the lawn or the gardens or whatever. And you would grow and be enriched by that, even though it came from a trauma. And that's true with this virus as well. So if you go to the medical profession and they diagnose you as X, Y, or Z, and you take things that they suggest you take as X, Y, or Z, then see how you feel. Can you also do things with traditional and modern health? And what's the difference between traditional and modern and natural health? The Shaolin exercises on this piece of paper are traditional. They come from a long line of traditional healthcare in Chinese medicine. There's Ayurvedic that came out of India. There are lots of different traditional health systems out there. Meditation is a traditional health system. And in fact, a lot of modern natural remedies come from Western traditional health. If you take chamomilla to relax yourself, that comes out of Western European traditional health care. So when you're thinking of natural health and traditional health and medical health, from our viewpoint as common knowledge trusts, use them all. When you're using natural health for yourself, when you have an issue, so you go in to your doctor and they say, well, you have asthma-like breathing problems, or they can call it a COPD, or they can call it dysfunctional breathing, whatever they want to call it. And they put you on a one of those things, right? That's okay. That doesn't stop you from learning better breathing skills and how to breathe better. It shouldn't. So let's say you go to a therapist and they go, well, it's all in your head. This isn't physical. And you don't believe them, but you go, okay, and they put you on an antidepressant. They're trying to calm down that autonomic nervous system overreaction of the sympathetic nervous system. You have heart palpitation, you go to a cardiologist, a different field than your therapist. They put you on a beta blocker because your heart's all over the place. That's really a form of antidepressant to your heart because it's dealing with the autonomic nervous system. So can you deal with the autonomic nervous system in natural health or in traditional health? Absolutely. But that requires growth on your part, emotional growth, intellectual growth, understanding of something you probably never paid attention to. I certainly didn't. The sympathetic nervous system and the parasympathetic nervous system. Sadly, the sympathetic nervous system is the bad one, right? The parasympathetic nervous system is the good one. So regardless of whether this is a cardiovascular issue or a pulmonary issue or an autoimmune system issue, if you can activate your parasympathetic nervous system for longer periods of time, then you will feel better. Because the parasympathetic nervous system, whether you look at it medically or whether you look at it through traditional health or through natural health, is what calms you. It's the system in which you live in a calmed manner. And if you've been traumatized, it's hard. And so you shouldn't beat yourself up. It's hard. When we are disoriented because this tornado just wiped out our house, that's hard. It takes time for us to orient and to make sense out of something which is very traumatic. So when I read on the Facebook pages about people who are dealing with symptoms, you hear people saying, I'm taking this, I'm doing this, I'm doing that. And really, good on you. Applaud. Okay? Good on you. You're doing something for yourself. If you feel those things are working, share those with the men and women in the modern health system that you're working with. They may disregard you. On the other hand, they may perk up their ear and go, that's interesting information. And that's what you want, is we want at this point with COVID and with long-haul COVID for traditional, modern, and natural health to begin to come together. It did in other areas. Diabetes is a perfect example. 30 years ago, the medical profession said it has nothing to do with diet, exercise, or stress. They've changed their viewpoint. How did they change their viewpoint? It's not through research. It's by people doing things for themselves and going back and sharing it. And enough people do that and get better little by little by little. Then the medical profession grows in its maturity and spreads and broadens itself in its capacity to do this. So if you have a lot of anxiety and stress around this, if you feel a lot of those things, then you want to do things for yourself. One of the biggest things you have to do for yourself is to change how you're languaging things. So when I read that people say, I am depressed, or I am anxious, or I am angry, you are giving yourself a character identification. You feel those things, but you are not those things. So you have to literally change the language and say, I feel depressed. If you feel depressed, then there's something that you can do to change that. If you are depressed, you can't change it because you have identified with being depressed. You don't want to do that. This is transient. You will get better. Will you get better as well as you were beforehand? I have no idea. Could you get better than you were beforehand? Good possibility, because as you take care of yourself more, then you recover more and you start to feel better. So you may feel better in time than you've ever felt before. Not because of the virus, but rather because of how you responded to your recovery. So a lot of people on these forums had, before they got the virus, a very busy, high energized life. They were very active and they were living in the sympathetic nervous system. They just didn't know it. They didn't pay any attention to it and they didn't think it mattered. And so they were already stressed. And then this virus, or the tornado that wiped out your house, came along and it just added to the stress. So if it adds to stress, what does that do? That stimulates the sympathetic nervous system, which is your fright, your flight, your fight, or your freeze. And that's what a lot of the messaging on the Facebook groups are about. You're pissed off, you feel like you can't do anything, and you're angry. And that's where my hope by doing this playlist begins to change how you respond to this traumatic experience that you've had, which is begin to learn how to activate the parasympathetic nervous system. And I have a number of ways on this playlist, and there are a bazillion more. As I said, you can go to YouTube and find wonderful brain waves or soothing music. What you want to do is to recognize when you're feeling calmer. And then you want to maintain that calmness more, which is sometimes breaking habits. Because if we're used to being overly stimulated, it can be very addictive. So we can be calm and then we start thinking about something or say, no, I need to be busy. And then we activate our sympathetic nervous system and get on a roll again when it isn't necessarily the appropriate time to do that. There's lots of wonderful exercises on YouTube, lots of wonderful supplements to work with stimulating your parasympathetic nervous system. I've been focused a lot on breathing because if we stimulate the parasympathetic nervous system, then we're biomechanically and biochemically making a change in our body. In the sympathetic fright, flight, fight, or freeze, our cardiovascular system constricts, our lungs constrict, our blood vessels constrict to our heart and to our brain and to our extremities because we're in I've got to move soon belief. When we activate our parasympathetic nervous system and we dilate this 100,000 miles of blood vessels all through our system, we then are able to get our oxygen out further from just being in our bloodstream. And when our oxygen is used more, then our breathing settles down, our heart settles down, we think more clearly, we have warmer hands or warmer feet, we have more consistent energy. So that's good. And so if you can stimulate, activate, and maintain your parasympathetic nervous system, then this is what you need to know. Because once you start to have fewer and fewer symptoms and you're getting back to your life, you have a choice. Either continue to grow and mature your parasympathetic calm nervous system, or say, well, I'm done with that now. Now I'm going to go back to being overly energized. Where the maturity comes from is doing the things that you do in your life and doing them with an activated parasympathetic nervous system. That takes some work. So as I've said previous to people, I do work with people online via Facebook. And when you find these videos on Facebook, please share them. The medical profession needs to learn more. You can help the medical profession learn more by caring for yourself. Whether you use traditional health care, natural health care, or their suggestions, you can do all of those things to better yourself. We have an opportunity with COVID to better ourselves, to be better than we were before we came into this. Let's use it as that. It's a way to get better. Let's work to decrease the intensity of the episodes or symptoms. Let's work to decrease how long those episodes of symptoms last. Let's work to increase the space in between. And let's work to be able to do what we do in life, doing it from this calmer place called our parasympathetic nervous system, we will be more efficient, more productive, and we'll enjoy it more, and we'll feel less stressed. So that's my blurb. Talk to you later. Bye-bye.